Anyone else want to make sure? Okay. Well, great. And please continue to introduce yourselves in the chat. Please don't hesitate to reach out to me or to Jen if you have any questions or thoughts, ideas. Excited to hear from you all and to continue, hopefully, what is creating a great forum for all of us. So, Jen, I think I'll pass it over to you for some of our agenda items.
Thanks, Jessica. Welcome, everyone. If you don't know me, Jen Petit, Senior Manager for Leadership Programs. Been in the role for a few months now, so hopefully we've connected and I know what's going on at your organizations and all of that. But just a couple of updates from our conference perspective. We're already middle of September, and we are charging forward onto November for our conference this fall. If you haven't claimed your complimentary tickets, I'll put that link in the chat so folks can do that. But if you have questions about securing those tickets or securing extra tickets for any additional attendees that want to attend outside those complimentary tickets, happy to take those questions via email and get you all set up so you're ready to go for November 18th through the 20th. We also have our Gail Warden Award Dinner, and we do have tickets still available for that for another month or so. So be sure to register for that. That's the evening of 19th in November. So perfect timing aligned with our conference. The agenda is up on the website. We're just kind of plugging along and getting all of our details finalized, but looking forward to seeing many of you in person, hopefully in November. And it's my favorite time of year because I get to connect with you all in person versus through camera. The only other, not necessarily NCHL update, but update and discussion for us today, wanted to bring back the conversation around a group white paper. And Jessica and I talked a bit about this as we start to look at what the rest of this year looks like and into 2025. We had sent out a survey a couple months ago around what a white paper could potentially look like, and really would just be kind of a written format of what we do in this group, the best practices that you all have, the programs that you're working on, things like that. The top three, let me get my top three up here. Our top three focuses that folks were really interested in were leadership programs and best practices generally, early leader development, and coaching programs and best practices. So we'd like to pick one of those three to kind of charge forward with for this year and into 2025. With that being said, it wouldn't take the place of these meetings. They would be ad hoc meetings of just connecting to make sure that we're pushing that paper forward. Leah and I would be the editors, making sure that all of the content is formatted and put together. We would just ask for you all to contribute your best practices so we can share that in a different forum than the monthly meetings that we have, and be able to share that resource with all of our Lens members. So does anyone, I'll open the floor, anyone have either questions on the opportunity for white paper or strong opinions for topic, whether that be, again, the leadership programs and best practices, early leader development, or coaching programs and best practices?
Jen, I would be curious if early leader development is synonymous with aspiring leader development, or would that be considered two separate things? We're in the process. We kicked off this year at Cone Health what we call our new leader engagement series. And those are people new to role and new to leadership that we've identified, and it's gone really, really well. And for this next 12 to 18 months, we're going to be developing an aspiring leaders program. Look at our programming for aspiring leaders might be a better way to say that. So I would be, all three of those topics I think are appealing. I would be curious about the one about new leader development.
I think that's a great question, Melissa. Honestly, we could take it and describe both. I'm not trying to put more words on paper, but that would be an interesting perspective to kind of detail both and the differences that different organizations have across the country. I think that would be a good way to position that paper.
I like that thinking, Melissa. And when Jen and I talked about this, I think on one hand, the general topic of leadership development best practices would be one that I'm sure we could all contribute to, but it might be too broad. And so I almost kind of the appeal of something a little more focused, to your point, whether it's around new leaders or aspiring leaders, or the idea of coaching, because I know not all of us necessarily have a coaching model, but might be a little more focused. So I think even that's a question. Do we want to go broader? Do we want to go a little bit more narrow and specialized? Would it be helpful? So Jen and I talked about this too. He said, my team has done a couple of sort of case studies, I'd say more so lately. And maybe an idea would be even to share an example. And I think some of my hesitancy originally would be, oh, how much time is this going to take? How much writing am I going to have to do? Where I think part of it could be, we're looking at all of you representing these incredible healthcare systems, and the ability to even kind of curate little pieces, examples, et cetera, from you. And so I think we don't want to scare you away with this is going to be really intensive of you authoring like a dissertation, but maybe we can kind of even follow up and gauge some of that interest, like to what degree would you want to be involved? Are there certain things we could maybe even narrow it down further? Would you be open to even just sharing some examples if we reached out to gather some of that? I think it's one of those things where we all can't have our hand in it because it may not get done, but that's where I think maybe some focus might even be helpful in sort of narrowing how many of us will really dig into it and carry it forward. Just a couple thoughts.
I'll just add, we've done a white paper with the NCAF Administrative Council folks, and really was a couple paragraphs to Jessica's point of how much time and effort, if we get enough folks that are interested and involved, to be able to not put together a 30-page paper, but something that at least helps kind of shape whatever topic around that we're looking for. So like Jessica said, I'll send that around and some of her case studies as well that UPMC has done, and then we can connect a bit further.
I love that idea. I love it. And I know in previous meetings, Jim, we'd also talked about, I don't know if I'll say this well, but resource sharing, resource catalog, something like that. Just so like, if I know that Jess has developed something at UPMC that we are now wanting to develop, I would know to go to her and whatever degree she could share, and we could personalize it for Cone and vice versa. We have an executive program, et cetera, et cetera. So I just think, we had talked about that before, and we would definitely like, I think your description, Jess, was we run lean and mean or something like that. We do too. We have a very small L&D department for our organization. And so any sort of resource sharing that we could be involved with, we'd be thrilled to be.
Thanks, Melissa. Any other thoughts, Joe? I want to make sure I'm not.
Yeah, excuse me. Same here. Happy to be a part of it, whether it's resource sharing or drafting the white paper. So count me in.
Thanks, Joe. Well, with that, I will hand it over to our presenter for today. Joe is with NUSC, and she'll be sharing some information on their physician leadership programs, as Jessica alluded to earlier. So I will hand it over to you, Joe. Feel free to introduce yourself, and you should have screen share. So.
Is everyone able to see my screen? All right. Well, thank you all for having me here today. I am Jo Sullivan, as Jen mentioned, and I am the program manager at the Leadership Institute of South Carolina. And along with Alicia Brownfield, our Director of Strategic Leadership Development, who I think many of you know from these meetings, I am charged with developing and implementing our leadership development programming for the entirety of our enterprise, and that's both our academic and our clinical enterprises. So I wanted to give a little bit of a background on the work we're doing on our physician leadership development. We've had kind of an interesting journey with our kind of philosophy on how we approach physician leadership and where we are today. So just kind of looking through what I'll be talking about is both a kind of an overview of who we are as the Leadership Institute, what we do, and then specifically how our physician leadership programming has evolved and where we are now. And then I'd like to close up a little bit with some questions and hopefully some discussion on maybe some sharing some kind of thoughts on where maybe some of you are in your programming and how that may compare. So a little bit of background about our Leadership Institute. I have our mission statement up here at the top. We're charged with furthering MUSC's strategic priorities and mission through the support and development of leaders. And one of the reasons I have that up there is we have been charged, and you'll see this a little bit in the next slide, but we've been charged with really looking at the way leadership development is incorporated within our strategic planning process as the enterprise. So making sure that our leadership culture is aligned with the organizational culture and the way that our organizational culture is moving. We want leadership development and leaders to be aligned with that. So we have 4 major priorities or strategic goals that we look at, and a number of initiatives under each of those. But first is we've developed a competency model kind of based off the NCHL model, but then also looking at some kind of internal needs of our own. Then making sure that that competency model is utilized throughout our enterprise and aligned with not only the work that we are doing in our department, but some of the other leadership programs that also exist within our enterprise. We are also looking at expanding our content. We have initially 2 main kind of flagship programs that we run, and looking at both the content within those programs, but then also additional programming. Then, of course, looking at best practices and making sure that everything we do is supported through the research and best practices. And then finally, looking at offering a high-level orientation for all incoming leaders. And I'll get into this a little bit more later on in the slides, but this has been kind of a challenging process for us, and specifically when it comes to physician leaders. So next, this is just a quick view of our leadership competency model. We have it broken up into 4 parts. First is our kind of fundamentals, which we offer for our emerging leaders. And this is kind of to your point earlier, Melissa, we categorize our emerging leaders and our aspirational leaders together. So our emerging leaders program includes both kind of new, but also those aspiring to leadership. Then we have kind of our high potential leaders, and we also combine these with our established leaders. These 2 kind of separate levels of competencies, but we address both of these within our what we call our advanced leadership program, which is for our high potential leaders. And then finally, our senior leadership, visioning and strategic planning and whatnot. So looking at our leadership physician leader journey specifically, in 2017, that is when our enterprise really began looking at the strategy of leadership development programming and incorporating it into our institutional strategy. We were one of the major initiatives of our 2015 to 2020 enterprise strategic plan. And it was at that time that we started doing a lot of work across the different matrices of our enterprise. We have, through the last 10 years, done a lot of really great work on trying to kind of break down some of the silos that exist within our enterprise, and this is part of that process. Shortly, through this process, the MUSC Health, which is the clinical enterprise, they began a physician leader training program that was specifically developed and deployed with an eye on fundamentals, operational leadership, as well as some of the other competencies that we work with is for that emerging and also the high potential leader program. That was running for about a year and it was successful, but what we found was that it ended up being a bit redundant in terms of what we were offering with the other leadership development programming that we were doing. And in 2019, we launched those two flagship programs that I mentioned, the Emerging Leaders Program and the Advanced Leadership Program. These two programs are enterprise-wide. We admit applicants from a kind of a functionally diverse group of people across the enterprise. So physician leaders are a big part of that, but it also goes to academicians, researchers, nurse managers, all of the different types of leaders we have across our enterprise. What we did at this point was we kind of ended that MUSC Health physician leader training in lieu of having physician leaders participate in these two programs, which was very successful. And we've been running that for about 5 years now. Over the last 2 years, we have begun a series of focus groups and exploration into what the unique needs of physician leaders are now, especially post-COVID, and how our programming either meets those needs or what some of those skills gaps are, and how we might be able to kind of best serve that population moving forward. So we've been doing a series of focus groups, and we are now kind of on the cusp of developing some additional physician leader programming, which I'll look at with you in a couple of slides. So a little bit of background on these two flagship programs. Our advanced leadership program is a small cohort of 25, and it is highly competitive. It's nominated faculty and staff, as I mentioned before, functionally diverse. They meet in person over a course of 7 months in full day retreat sessions. Anyone who is accepted into this program has to be an established leader of either people or programs with high potential for senior leadership. They also must be responsible for results. So those are kind of the benchmarks of who is accepted and how. And again, just as a reminder, these are the competencies that align with our curricula. For our Emerging Leaders program, we kind of launched as with the Advanced in 2019, 2020, and we initially launched very small, a cohort of 50 in person in our Charleston campus. And one of the happy byproducts of the COVID experience was that we were able to then move virtual, and doing so enabled us to offer our programming across our enterprise. We have 16 hospitals, we're throughout the entire state. And so we were able to reach a much larger audience. And so now we are a fully virtual webinar style programming with an unlimited cohort number. So if you apply and you meet our criteria, which is really a newer emerging leader whose supervisor signs off on your participation, then you're able to participate in this program. And again, these are those emerging leaders competencies that we look at in our curricula. So one kind of point I want to look at is our physician leadership population at MUSC is fairly small in comparison to the rest of our employees. We have about 26,000 employees across the enterprise, and physician leaders make up a tiny part of that because of kind of the diverse nature of an academic health system. So when we look at kind of our physician leadership participation in our programs, more of them are participating in our advanced leadership program than our emerging leaders. So they're much more interested in that kind of programming offering. And it's a small number, but that is, commensurate with the overall percentage of our employee and leadership population. So as we've been going through our focus groups and some of the discussions we've been having, we noticed that, again, the competencies do align, but what is missing with our physician leadership development is these kind of 3 main buckets. both with the patient experience, healthcare operations, and patient quality and safety. And one of the things we have been looking at is how to best deliver this content in a way that is easy for physicians to schedule. We're looking at kind of the timing, the format of these offerings, whether they are self-paced, whether they're asynchronous, whether they are webinar style, whether they're in-person seminar workshops, or how we want that to look. One of the things we have looked at is the orientation specifically as a major need of both our physician leadership population, but also all new leaders across the enterprise. So we're in the early stages now of developing an enterprise-wide new leader orientation. Our health system currently has running a new leader orientation that is kind of being worked, and then we are going to gradually increase that to include our academic enterprise as well. We are also going to be looking at the physician leadership orientation and what specific needs that has to include for their purposes, and have that as kind of a subset of the overall new leader orientation, so that we're not duplicating content, but they have some additional things available. We're also looking at developing some physician leader workshops and online modules that can be offered. We're still in the early kind of exploration phase, so we don't know exactly how this is going to look yet, whether it's going to be mandatory for all physician leaders, whether it's going to be opt-in. If it is mandatory, what does that look like in terms of their protected time and scheduling needs? So especially when you look at RVUs, how is that going to be considered, and how is that going to be secured so that they can take advantage of those programs? So those are really what we've been working on and how we've been developing this. And again, we are in the early stages now of implementing some physician leader programs. So I'm happy to answer any questions on what we've been doing, but also I'm looking forward to any kind of thoughts on what you've been working on with your own physician leadership development, and having a discussion on that. So thank you.
Thanks, Joe. I do have a quick question. How are you defining and measuring success? Like, what metrics are you using, or how is it that you're capturing that?
Yeah, absolutely. Thank you. That's a great question. So we do have a series of outcomes that we've developed with our reporting body. We report directly to our President's Council, and they have kind of signed off on a series of outcomes that look at some very qualitative data like retention data with each of these programs. We look at some self-reported data through an alumni survey that we do, which includes promotion both within our enterprise, but also we look at whether leaders have been asked to lead national associations or committees, and what that kind of thought leadership looks like outside of our institution. And so that's also one of our metrics. We look at how we have kind of grown in terms of our impact within our organization as well, and what that looks like. And then we have some more qualitative markers of, self-reported measures of their own success. So questions that we ask, like, how has your ability to communicate within your team improved, and what we have like numerical markers on that, and your ability to along those competencies in their own kind of self-reporting of that.
Awesome, thank you.
Jason, I see your hand up.
Yes, thank you, Joe. Wonderful presentation. Really appreciate it. Specific to the leadership orientation sessions or modules, or however you're terming that, I know it sounds like it's in the early stages, or you're still working through that. Any ideas around content or what that may actually entail?
Yeah, absolutely. So as I think I mentioned, the MUSC Health section of our enterprise specifically has rolled out a new leader orientation. So that is It's in practice, it's, being utilized as we speak. And they've had a version of that for the last several years. So they've been working through that, and it's been very health focused because it has been on the health system. And so now, as we're looking at expanding that to the rest of our academic enterprise as well, we're looking at ways of, what are those specific fundamental skills that new leaders need to have. And those are both structural about our organization. Where do you find information? Who do you go to? What does it mean to be a leader? How do you set goals? What is the budget system? Things like that. But then also some of those more emerging skills about communication and things that are more broad, can be more broadly taught to a larger group. So that's kind of our challenge now, is as we expand it, how do we scale it up to the amount of new employees that that's going to include? And how do we make access to that make sense for the different functions and needs of our population?
Any ideas around requirements or this as a required module? That's something that we struggle with a bit, because it sounds like we have something similar in place already. And we say it's kind of required, but it's really hard there's not a policy around it. So we have a university, we have a campus required set of trainings that are technically required. And so they have a little bit more enforcement around it. But the work that we do, we've always struggled a little bit in terms of being able to say this is something you must complete, though most people do it. So what are your thoughts around that?
That's a really excellent question. And yeah, that is something we have been struggling with. The health system does require participation in the new leader. So every new leader who is either, newly promoted to a leadership role or comes to our institution in a leadership role has to, go through this program. And there's kind of initial seminar style retreats that are involved, but then there's a 30, 60, 90-day follow-up for all new leaders. And that's easily tracked through we have a Workday system that we easily track that through. The challenge we have been finding is, as we expand through our academic enterprise, the definition of a leader becomes much murkier, because, you'll have clinical leaders who also have academic faculty appointments, or you'll have somebody who their official title is professor, but then they are also a director of a major program, and that's not necessarily reflected in their official title. So how do we kind of enforce that mandatory new leader training becomes much more difficult. And so that's one of the things we're currently exploring.
Thank you very much.
Joe, thank you. This was so comprehensive. And a question, maybe a few. I tried to write them down here. So one question is, do you or your team facilitate all of the content, or do you bring in other subject matter experts? That's always an area of curiosity for me, because particularly with our physician audience, I think there is this, which I think we've debunked, but there's this tendency of physicians only want to hear from other physicians. And I'm curious, if you involve any of those subject matter experts to present, or if it's solely your team, is my first question.
Yeah, no, that's a great question. We do bring in subject matter experts, but we try to rely on utilizing those experts from within our organization. One of our basic tenets that we really try to keep with is that we want to expose both our new and our high potential leaders to other senior leaders within our enterprise. So having them, put faces to names, have them interact with them, whether it's, via Q&A or if it's after a session, having that exposure, we have found it to be really important. So we have tried to make our presenters, if it's not myself or my colleague Alicia, it is other senior leaders throughout our enterprise. We do bring in maybe one or two external speakers, but it's fairly limited.
Thank you for that. And then can I ask another question? So, and maybe help me clarify too, because it sounds like maybe you have mixed groups, so to speak, like those populations where physician leaders may be alongside those academic leaders or whomever we want to call them. And that's always been interesting to explore for me. And I'm curious from other groups too, of that. Do you have forums like that, leadership development related or otherwise, where you're bringing them together? And if so, what are the kind of greatest synergies you see from that? And what are the rubs or potential rubs that have come up with it?
Well, I know with our experience, we've had some really great experiences with specifically our high potential leader program, because we also incorporate kind of an interdisciplinary innovation project as part of the program. And so they're put into functionally diverse teams where they kind of collaboratively work on kind of a magic, if you were the president, which problem would you solve? And that usually gets whittled down to more functional area, but having that ability to collaborate with people from across the enterprise gives them exposure to the larger visioning of what MUSC is and gets them out of their silo and out of their kind of their blinders on of what their day-to-day job is, and allows them to understand and experience what MUSC as an enterprise is and what those challenges become as you become a more senior leader. But to the other point, what are some of the challenges that we have? A lot of that is some content they may not feel is applicable to their work, and finding that balance of what is kind of too specific to kind of a profession. We've tried to make sure that whatever we offer is much more general, that can be kind of utilized regardless of what that profession is, because of that concern.
Great, thank you so much. I appreciate that. And curious too from other groups if you have similar where you've got physicians alongside those other leaders, any of your feedback too.
Jessica, I'm going to read between the lines, and I'm going to offer us up as we are very much in the model that our physicians like to other themselves. And so we have a completely separate physician leadership academy right now, and they don't even want to entertain APPs being a part of it. And so we have a lot of history and silos to begin breaking down. It is so other that it is not taught by any faculty from within our organization. It is externally led, and we're running into our own problems with that model, as you can imagine. But it was started probably 12 years ago with this model. We partner with the Center of Creative Leadership, who happens to be also located here in Greensboro. And it started out with all of the best intentions. And honestly, the program still has the best of intentions. But what it's done is it's bifurcated from our leadership philosophy as an organization. And it's not in harmony anymore. And so we have a lot of work to do, and are going to be doing a lot of work in our provider leadership, physician leadership space this year. So, but I'll offer us up as a model of a group that likes to other themselves from the rest of the organization in terms of leadership development.
Well, and you're not alone, Melissa, because ours, and Martina has been here from my team before to talk about our physician leadership development program, which we were just proud and excited to get it off the ground and have something devoted for physician leaders. But now, as I hear some of these opportunities and that ability, I think we've surpassed the hurdle of they only want to hear from physicians. I think we've gotten past that, and they're very open and excited to hear from any of our facilitators. All of ours are internal as well. But we do bring in some physician leaders to review things like data analytics with them and otherwise, but we cover a lot of the leadership topics, the traditional leadership topics. But I just see all of those great values and benefits, Joe, that you shared about the perspective sharing and just really understanding the full scope. There's just so much I think that could be accomplished with that. So it's just interesting to hear what others' experience has been too.
Yeah, we're the same here at Ohio Health. And to the point where the Physician Leadership Academy wants our Leadership Academy content, but they don't want their physicians to attend with us facilitating. And they're like, give us the content and we'll do it. I'm like, no, let's put us all together. So yeah, fighting the same battle here.
Sorry, I don't mean to like dominate the mic, but one idea that, and it sounds, Joe, a little bit like what you've done too. It sounds like you have the President's Council. One of the things that has been very helpful for us is when we got the program off the ground. Martina had a group of physician leaders who were part of the pilot that helped to shape all of it, and they were also the pilot participants. And then we took some of them and then also kind of handpicked other physician leaders to become a physician advisory board to our efforts. And so they're not our senior leaders, but they're representative all across the organization, and they help to inform our direction strategically and also champion it outwardly to their peers. And so just something, if that, Joe, kind of could help of buy-in and that support, it's that you're able to kind of push it back and say, we're working under the guidance of your peers to make this happen. So it has helped, I think, us in many instances to have that group.
I think part of it depends on where individuals are in their leadership journey. We have physician-specific programs. It's really provides because we include APPs as well. And if that's where they are in their leadership journey and that's what they need, and they need to interact with other providers, then they have that opportunity. But we have physicians and other providers who are part of all of our other general leadership programs because that's what they need at that particular point. They may need to have greater access to other areas of the enterprise because they have been so narrowly focused. They have been in their silos, and they realize that they're not getting the perspective of other roles and responsibilities throughout the entire organization. And so that's where they are at that point in their leadership. So I think it's kind of understandable sometimes that the physicians do want to be with other physicians. I get that sometimes, and I appreciate that and respect it. But that's not always the case. It really is just dependent on where they are in their leadership journey, I believe.
Thanks so much, Joe. Any other thoughts or feedback or topics related for discussion that anyone wants to raise? Really good feedback. And again, thank you for that great overview. Certainly got me thinking. Jen, is there anything else before? I know we're a little bit early. We've got some time. I want to create space if anybody does want to use any of our time together.
I was gonna say, or if someone has a question outside the specific topic, we have the time to use, but if not, we can give folks back the time too. Hearing none. Jessica and I will be following up with white paper and kind of next steps for that. But Joe, I want to thank you so much for the presentation today. Very insightful, and we'll be sharing those slides as well with folks on the member portal. So be on the lookout for those.
Great.
Thanks, everyone.
Thanks, everybody. Take care.
Thank you.
Bye.